Good morning, everybody. Welcome to the Cyber Psychology Seminar Series. My name is Dr. Julie Ansis, and I'm the director of the Cyber Psychology program at the New Jersey Institute of Technology. Some housekeeping rules before we begin. If you could please keep your microphone muted. We will have a question and answer period during the last 15 to 20 minutes or so of the presentation. If you could please put your questions in the chat box with the word question or even Q in the prefix, so I'm able to differentiate questions from statements. The Cyber Psychology Seminar Series is designed to showcase the many different facets of research and scholarship within the field of cyber psychology. The series features some of the nation's leading experts at the emerging intersection of psychology and technology. It is a pleasure to have with us today Dr. Corinne Datchi. Corinne Datchi is an associate professor and chair of the psychology department at William Paterson University in New Jersey. She is a fellow in the American Psychological Association of the Society for Family Psychology. She holds a Ph.D. in counseling psychology and is board certified in couple and family psychology. Dr. Datchi is vice president for practice of the Society for Family Psychology and serves on the editorial board of the APA journal, Couple and Family Psychology Research and Practice. Her clinical and research interests focus on the treatment of couples and families in various settings, including the criminal justice system. Dr. Datchi's clinical practice includes telebehavioral health services for couples. The title of her talk today is Telebehavioral Health with Couples, Technological and Treatment Opportunities. So welcome, Corinne. It's a pleasure to have you, as I said, and I'm just going to turn it over to you now.
It's a pleasure to be with you all. I consider you to be a sister institution in a way, since you are in New Jersey, we're neighbors, and hopefully there will be collaborations, more collaboration between NJIT and William Paterson. We're not too far from each other, and I think we have a lot to work on together. So thank you for having me. And before I start, I just want to say that I prepared this presentation thinking that my audience would be, for the most part, not clinician, but people who were interested doing research or studying technology in its various facets. So if there are clinicians amongst you, please feel free to ask questions at the end that are more clinically oriented. But what I'm trying to do is, what I will try to do in this presentation is highlight the interface between clinical practice and technology. And there's certainly a lot, and you might also see that there's a lot more to do to advance that particular aspect of practice in the clinical world. So I'm going to share my screen and start my presentation. So today's talk will focus on telebehavioral health with couples. There's actually very little written about telebehavioral health with couples. Well, there's been a lot of research on telebehavioral health itself. The literature about couple therapy using technology is sparse. However, what I will try to highlight are opportunities for technological as well as treatment advances in the field. I think there's a lot to do, and I'll also share my clinical experience working with couples using technology as well. The objectives for this presentations are to give you a sense of how technology has been integrated into the field of behavioral health, to provide a definition for telebehavioral health as well, and to also let you know how many words there are to represent or to talk about the field. I will also highlight new technological developments in clinical practice in recent years, talk a little bit about the effectiveness of telebehavioral health in general, also discuss the pros and cons of using technology in behavioral health, and focus, the last part will focus on telebehavioral health with couples, in particular video conferencing psychotherapy, what we call video conferencing psychotherapy. So let's look at the field and how the field of behavioral health has integrated technology in its everyday practice. And technology is not something new in behavioral health. We have been using technology for almost 30 years. And when we talk about technology, we can talk about the phone, hotlines, or even when clinicians use the phone before their first initial interview to have a preliminary contact with their patients. So some clinicians will also provide counseling on the phone. So the phone is also maybe not new technology, but has been used in behavioral health to deliver services. Email correspondence therapy as well. We have been using email to communicate with patients. Email can be used in various ways, whether it's for scheduling or even for first contact with patients. And patients often use email to share information with their providers. I mean, there are some legal and ethical boundaries around the use of email and any technology-assisted communication in behavioral health. I won't go into that today. It's not the focus of this presentation, but I just want to highlight that those two. Finally, video conferencing psychotherapy is not new either. We have been using audio and video transmission to deliver services in remote areas for quite some while. So the key message is really technology has been an integral element of today's mental health practice, and mental health practice in person, not only remotely, to communicate and also consult, provide consultation, whether to clients, but also to our colleagues. We use phone emails. We've been using phone emails and text. We also use technology to advertise services, whether it's on our websites or through social media. And as well, we've been using technology for record-keeping purposes to share documents with our patients. So we now use, most of us use electronic records. These are records that are located in the clouds. And we use those, the technology to be able to communicate with our patients, share documents with them, have them sign those documents in the clouds. And now electronic record-keeping software even allow you to do video conferencing psychotherapy with your patients. We've also provided online-only services to our patients for quite some time. And if you go and look it up, if you go on the web and look it up, you have companies that are now offering counseling services for a minimal fee. You pay a weekly fee or a monthly fee to have access to services online. So some of those companies are Talkspace or BetterHelp. And for couples, there is a company called Regain that offers some couple therapy services online, whether it's text-based or whether it's audio, if you would like to have an audio meeting with your patients or your patient wants to talk with you, or whether it is video communication. So here's a description of Regain and what they, how they present themselves on the web. Basically, what they offer is that your patient can go to a private chat room that's dedicated to them, where they can communicate privately with their providers 24/7. They leave a message, and then the provider, the therapist, answers those messages, and they can enter any time through any device, whether it's their phone or their computer, and they can talk about things that are going on in their relationship, ask questions, and then receive advice from their counselor. So these are the types of services, online-only services, that are available, that are technologically assisted. Oops. Telebehavioral health. So if some of you are interested in doing research, you will find that telebehavioral health, as is called different names. You will find words like terms like telemental health, telepsychology, online counseling, e-therapy, video therapy, distance therapy, cyber therapy, technology-assisted counseling. So if you're doing a search of the literature, there's not one unique words that we use to refer to these types of services. It has been defined, there is a definition of telebehavioral health, and this one is provided by the APA, the American Psychological Association. If you go online to their guidelines, you'll find how they define the term as the provision of behavioral and/or mental health care services using technological modalities in lieu of or in addition to face-to-face methods. And this is something to highlight. Technology-assisted counseling services or psychological services can be in place, but also in addition to, and I'll talk more about some new technological developments in the field, and I use some of them in my clinical practice when I want to add to the in-person services I provide to my patients. So video conferencing psychotherapy is probably one of the newest, or one of the, what I categorize as new technological development is we are, as technology develops and becomes more sophisticated, we're now able to provide synchronous, interactive, and real-time services to our patients, not in person, but in a two-way audio and video system. Some of the platforms that are available in the field for us to use as clinicians are VC, and these are the most used in the field, VC, Zoom, and Doxy.me. I could show you, if you were interested at the end, what Doxy.me may look like if you're not familiar, and if you haven't yourself already scheduled an appointment with a provider. Doctors, regular doctors, your PCP may have used this, or even your specialist may have used this particular platform. And the reason why I linked this to the web, Doxy.me is the platform I use to deliver services. So let me see here, I need to change. BITs, or behavioral intervention technologies, are self-administered, automated. Usually they come in the form of an app that provides psychoeducational material, psychoeducational counseling to patients. They can be guided with asynchronous communication with coach or therapist, or they can be just automated, where people, consumers will just download the app and use them as they please without the help of a provider, a mental health provider. Those bits are designed to enhance in-person treatment. For example, if you're working with a therapist who have more of a cognitive behavioral approach to treatment, they may suggest that you use an app to track your thoughts and behaviors between sessions, and then they would use this information to deliver in-person treatment or services. They're also designed to provide self-help intervention with or without a coach. And here I've listed a few examples. One app that I often use is this app here, the Mindfulness Coach app, which was developed by the Veterans Affairs. It's an app that coaches you, teaches you how to use a mindfulness practice to help with symptoms of anxiety. For example, for people who are very anxious, I usually recommend that they use the app between the sessions to learn strategies to stay grounded in the present and to better manage their symptoms of anxiety. Virtual reality is, I will say, the newest development in the field, and it's very exciting. And I'm going to show you how it works when I click on the list. The University of Rochester has developed a virtual reality app that offers cognitive behavioral therapy. So it's basically a smartphone app that can be downloaded, and it offers an immersive experience where you can see and hear the therapist and also look around the office as you use the app, which other apps do not provide. Other apps are two-dimensional, although they provide feedback as you move through the programs. It can also be interactive, where patients' responses determine the next activity. So what I'm going to do is go to the web now and show you how these apps work. And I probably need to change what I'm sharing. So let me go. Here. I'm going to play this video for you so you have a chance to see how it works. I'm also going to move around the room and show you what it looks like.
It is also important to practice the concepts you learn in each module. Before we see each other again, you can engage in several activities to help you practice identifying the different emotions you experience throughout the week. Please check in with the program at least once a day and identify whichever feelings you are experiencing. I think you'll learn a lot about the way that thoughts influence feelings and situations evoke different emotions in you. See you next time. It is also important to practice.
So let me go back now to all right. So you had a chance to, this is a great example of what we're able to do with virtual reality and how we can provide patients with more of an immersive experience where they can look around the room, which I think is very exciting. And they're probably, using this type of technology, even doing couple therapy. And I'll explain later how this may be very helpful to the therapist. Measurement feedback systems also use technology. It's a technology-assisted clinical tool that we now use to track client responses to treatment. So how are they changing? And it's a tool that's helping us use data to tailor the services that we provide to our patients at the individual level. So really to use the data we collect to figure out how they are responding to the treatment we provide. The data collection and the translation of the data, or the analysis of the data, is simultaneous and is translated into clinical feedback. For example, graphs or pie charts that describe how the client is functioning, or whether our therapeutic relationship is strong. It highlights areas that we need to target in treatment. It provides information that's really important for us to make treatment decisions and to guide our session planning. It also encourages, in many ways, technology is helping us to take into consideration our clients' experience during treatment and not rely only on our perception of how things are going and how judgment of or clinical judgment of the client's improvement. In many ways, technology is also helping us enhance collaborative practice where we take into consideration the client and their experience and what they report to us. It supports, what's really interesting for us in the field is psychology is grounded in research and empirical evidence. Technology-assisted and measurement feedback systems in particular supports our implementation of empirically supported manualized treatments. And those are treatments that have been tested in the field that we know are very effective for our populations. The difficulty, though, with empirically supported manualized programs is how their implementation varies from clinician to clinician, and it's really important to verify that clinicians are implementing the model in the way that it was designed. And those measurement feedback systems help us do that, increase model fidelity, and support the implementation of evidence-based practices in the field. Some examples in the field of couple and family therapy, in particular, the systemic therapy inventory of change is one example. And Care4 is another example. There are other measurement feedback systems. I know of 5 in the field. The OQ Analyst and the PCOMs are 2 more, and maybe more directed towards work with individuals and not couples and families. Here's an example that I was able to get from the internet. This is the OQ Analyst, and it provides an example of how the feedback is delivered to the clinician. So if the mother has filled out some instruments, assessment instruments, providing feedback about how they are doing in different areas, how they're functioning, this information is going to be translated, and you see the graphs here. As well as what's the status, it's green. Have there been any change, no reliable change? However, the feedback message here, and you see from session to session, so what you can track here is from session to session, how the person is doing in several areas of functioning. So the clinician is able to look at this information in an almost instantaneous way after the data has been collected and entered into the measurement feedback system. And the feedback is the rate of change this patient is making is in the adequate range. No change in treatment plan is recommended based on these results. So this guides our practice. So does it work? And I'm going to, my focus here will be on video conferencing therapy as well as BITS. Do they work? What do we know about their effectiveness with our patients? Are they improving? Are they helping us deliver good services that work? What we know from the research is that patients are highly satisfied with technology-assisted services, counseling and psychotherapy, as well as other psychoeducational interventions. We also know that the therapist is able to develop a strong relationship with their patients when they use technology to deliver services. Although the research suggests that there are mixed findings when we compare in-person and teletherapy. So therapists may not be able to develop as strong a relationship with their patient, which is really important to outcomes. The relationship is a critical element in clinical practice. Teletherapy may not be able to develop as strong a relationship with our patients as we might be able to do in person. However, this does not seem to be related to outcomes. It does not mean that, the relationship is not strong enough for us to be effective providing services with technology. In general, the outcomes are good for online delivery of manualized treatments like CBT, for example. There's also, the literature also reports positive outcomes, positive results of video conferencing therapy for parent-child problems, gender reassignment, mood disorders, adjustment and anger. There is very little written about guided bits in particular. Those are behavioral intervention, I think it's technology, that provide not only psychoeducation using technology, well, self-administered and self-guided, but also provide opportunities for the patients to interact with a coach or a therapist. What the little we have, the little we can read about is that the outcomes are superior to, or we achieve better results with guided bits than we would do if the patient was only on the wait list. And there are no differences. What we know, there's a technician could deliver the bits or the services for the bits or be the coach. There's no difference between what a technician might be able to provide, the support technician might be able to provide compared to the support that a clinician may be able to provide. So why is this important? This is important because the concern in the field is that we are only providing services to a small segment of the populations, and the needs for mental health treatment is greater, and we're not able to meet this need. So what technology is enabling us to do is reach a population that would never have had access to services in the first place. So that's one of the pros and cons I'll discuss later. There have been studies comparing in-person and teletherapy, and there have been mixed findings. Some suggest that in-person therapy may be superior to teletherapy. Others suggest that there are no difference. So what are the benefits and limitations of using technology-assisted psychotherapy or services? The first, and I've already mentioned it, that is, as it has allowed us to increase our reach and to also provide specialty services to populations that would not have had access to the services, especially in remote and rural areas, also being able to reach diverse populations in the country. Technology, which is an interesting finding, is that technology-assisted psychotherapy services also help us overcome the barrier of stigma, of mental health stigma. And what this literature suggests is the ability, when our patients are able to access the services from their home, they feel more at ease, and they feel like they have increased privacy. So for example, if you live in a rural area, there's more likelihood that someone may see that you're entering the office of a therapist. If you're doing it from home, your privacy increases as a result. Using technology also helps us lower the cost of participating in treatment, and also the cost in terms of time taken off work to go to the therapist's office, the cost related to transportation, parking, etc. In many ways, it overcomes, if you work with couples and families in particular, it also helps us, it's easier to bring everyone together into the session, and it's easier also to deal with barriers like childcare. How do you secure childcare? The child can stay in the home and with the family, and we can provide services. So in general, technology-assisted services are more flexible. They increase our flexibility. They are more convenient for patients. They make things easier, and as a result, also increase access and participation in services. Patients experience, or patient report, that higher level of comfort and ease of self-expression when they're talking in front of a screen, which is an interesting finding, that it's easier to self-disclose to therapists when they're talking to them on their computer. That's called the online disinhibition effect. Some patients also report that they feel more in control, that they feel more ownership for the session and for the process of psychotherapy, which is also an interesting finding. There are limitations, however, and this is something I've experienced very directly. therapy is only as good as the technology that you use. So the quality of the audio and visual information is going to be critical, and it does at many occasions, you know, it in many ways when you're doing therapy online with a two-dimension video and audio transmission system, it limits your visual range. So I cannot see what is happening around the patient at the time of the session. There might be, my field of vision is very limited, and I'm also limited in what I can observe about the patient. Often when the sound is delayed, so I may be trying to speak and I realize the patient is not hearing me, and that they hear me, my voice gets to them in a way that there's a lag time. So that's one also impediment, especially in couple therapy, when the partners are together in the room and there's negativity and the negativity escalate, and I need to intervene in order to interrupt those interactions and help the negativity decrease. The delayed sound just interferes with this process. When you're using a computer, when you're using technology to deliver services, your presence is different, and I would say you have less of a presence in the room with the patients. And that's something that's really important to consider when working with couples and families, where you need to intervene and have a presence in the room with them in order to manage their interactions and avoid escalation of conflict in the room, for example, with them. And that's been my experience, I do not have enough of a presence in the room through the screen, and I need to, the delayed sound also complicates this process, is where I'm able to be in control of what's happening between the two of them. That's limited. It may also have an effect on the sense of connection with the therapist, how much they can connect with you through the screen. Video conferencing creates a distance, obviously, and for some patient, it can also instill a sense of impersonality. So this feels impersonal to them for some patients, not all. There are also issues with privacy and physical boundaries when you use technology-assisted technology to deliver services. In my experience, patients will be on their video conferencing call with me, or they're videoing with me. They might be at home, but other things are happening at home and there are other distractions, or they could be in their car, or they could go for a walk with a dog. And so it's really hard to create the same boundaries that we would have in an office. Whether this has a positive or negative impact on the process of change and treatment itself, that is not something that we know yet. And that would be something to explore. How patients are using video conferencing in a way that challenges those privacy and physical boundaries. And I said distractions also can happen. A child walking into the room, for example, a phone ringing, or if they're on their phone video conferencing with you, they may receive a text, and you will know they receive a call or a text because your image disappears or their image disappears from the screen, and that's when you know you've lost. There might be some distractions. Telebehavioral health with couples. So here I will share my experience working with couples. And as I said earlier, there's very little research and very little written about telebehavioral health with couples. I may have identified at the most 5 articles. This is concerning because couples and families, couple therapy is very needed. If you look at the statistics and concerns there might be about divorce, 1 in 2 couples divorce in the United States, and how couple functioning also influences mental health in general, and telebehavioral health, in my opinion, or technology-assisted services, can really help us provide services to couples who would not have had access to the services in the first place. So it really can help us improve our reach, extend our reach to patients who really need it. So relational teletherapy, it's also called relational teletherapy, is the exception rather than the rule. And what the only article I was able to, the only intervention, online intervention, I'm sorry, there's the only family-oriented online intervention I was able to identify in the literature is a CBT intervention that was been provided online for parents of young cancer survivors. And this is more of a synchronous online peer support and psychoeducational group that's led by a psychologist, and with the goal of increasing families' quality of life. And here the content might be, they may learn about coping skills, mindfulness, assertiveness, or communication skills training, problem solving, or goal setting. There also is a description of parenting video conferencing therapy for ADHD. You can find those descriptions in some articles. It's a dyadic skill-based treatment program that's provided via video conferencing with their found good therapeutic relationship, good engagement, high satisfaction of services. So that echoes some of the results I've described earlier. And I have read about a report on behavioral couple therapy for gambling. I have not been able to identify that article though, but I wanted to mention it, that this might be out there. Video conferencing couple therapy, hold on a second, facilitates involvement of partners in treatment. And it makes it easier to overcome barriers related to time and distance. It makes it easier for the partners to come together and be involved in treatment at the same time and avoid conflict in scheduling with work or even distance. So it's not unusual for couples to say, we will not be in the same space at the same time. Can we video conference with you? I'm using a three-way video conferencing. It's not my preference, and I'll explain why, but that's something that I have done also with couples. Technology also helps us, in couple therapy in particular, to look at what is happening in the couple's everyday environment. So in their home, if they're doing therapy in their home in particular, it opens a window into their natural environment. And this provides very important information that we can take into consideration to understand what their struggles are, their difficulties are. When partners use separate devices, the literature indicates that it can also help them regulate emotions. So if you have two partners, then their relationship is defined by high levels of conflict. It's not unusual for them to reenact the conflict in couple therapy session. And so when you're delivering video conferencing couple therapy, you're concerned about the escalation of conflict between the two of them, and you have to manage it. So when partners are highly aroused, emotionally aroused, using separate devices can help regulate those emotions, promote empathy when they're able to look at each other from a distance and see their face on the screen. They're able to see their reactions and to understand each other a little better. So that's an interesting finding. Partners, so to conclude, when we are able to regulate, or when they are able to regulate their level of emotionality, that also helps engage them more in treatment. As I said earlier, the technology that is available to provide couple therapy via video conferencing limits our ability to observe couples' interactions. They sometimes fall outside of the field of vision But in other ways, it limits our ability to observe their interactions when they're sitting in front of the camera and facing the camera and looking at the therapist instead of interacting naturally as they would do if they were in the same room together with another person in the same room. So that's something that I have observed in my work with couples, and that the technology modifies their sitting arrangement and also modifies their interactions in the room. When you're doing three-way video conferencing, for example, you don't have, you cannot observe their interactions. You can observe their communication patterns through the screen, but that does not replicate what might happen in the same room when they're together. So this is information that we do not have to make an accurate assessment of what might be going on between them. This is why I typically ask couples to sit in the same room, and I try to be very mindful about how they're sitting, to ask them not to also look at each other, face each other. I ask them to do that over the course of the session. Of course, they're going to be looking at me to have a sense of how they might interact with one another. One experience I've had also is that couples like to log in on a computer and then link the computer to a screen, and what may happen is they may be looking at the screen or a TV, which makes me, which I guess they are looking at me as a picture, in a very big picture on the screen, which might be interesting to study as well, is what impact does that have on them. But they're also no longer looking at the camera, so I'm not seeing their eyes anymore. So I'm not seeing them face to face anymore. So that's something to watch. And in some ways, it can limit my ability to assess what is happening between the two of them. So the two-dimensional aspect of the technology that's available to us, in a way, creates some limitation. It also alters the flow of conversation. And I said earlier, this lag time that exists, it's difficult for them to know that I actually am saying something. They get the information, it's delayed, and I'm not able to manage their interaction, to interrupt negative communication right away with them, which can be an issue. With Zoom in particular, I think Zoom has this capacity to drown a voice so that two people cannot speak at the same time. So if you have a three-way conversation or three-way video conference conversation with the couples, then they may not hear you, especially if they're talking. And that's an experience I've had with couples where I've tried to interrupt them, but the technology would not allow me to do that because my voice was drowned. And I'll conclude with those remarks, and it would be difficult not to talk about COVID and the impact of the pandemic on our clinical practice today. And what I find very interesting is that before the pandemic and before the shelter-in-place orders, very few couples and even patients would consider the option of telebehavioral health. And this is something that I'm talking from my own experience. This is something that I've offered, and there were very few takers for various reasons, and probably their expectations, patients' expectations that it may not be as effective. It's not the same to do it online as it is to do it in person. But with what happened in March 2020 with the shelter-in-place orders is all our services transitioned online. And for the most part, 100% of the services that we've provided have all transitioned to an online format, forcing clinicians as well to seek training in how do we use technology in order to provide those services, but also opened a window of opportunity for our patients to discover that maybe technology-assisted services are not what we thought they were. And I think they've challenged their expectations, both clinicians' expectations, I think, and as well as patients' expectations. What it has also, the factors have contributed to increasing the use of online services, because we could provide services in person, right now we can, is the fact that third-party payers, healthcare insurance, are now reimbursing or we're asked to reimburse, or through some kind of order regulations, we're asked to reimburse video conferencing and phone-based treatment as well. So this has also created a window of opportunity for technology assisted services. And I talked about patients' expectations, the prior skepticism, and before March 2020, only 2% of clinical practice involved video conferencing. I would say that today in my practice, I would say 75% is done online. So the silver lining, maybe, I don't know if it's a silver lining of the pandemic, is that there's now what I've observed, and only my own observation, is an increased acceptance of technology for mental health services. And there's so much potential. I mean, there are certainly limitations that we need to address, technological limitations, and what would make it possible for me at the technological level to be able to expand my field of vision when I'm talking with couples, for example, in the same room, or how, if I'm doing a three-way video conferencing, how can we create a space online where I can actually see how they might interact? How can we recreate that space through technology? And that would be, something not in my realm of expertise, but certainly if in engineering, that might be something to think of, is how do we replicate that? And this is the end of my talk. Thank you very much. And I'm glad to answer any question you may have.
Okay, thank you so much, Dr. Datchi. That was very interesting. I myself have a lot of questions for you. There are questions in the chat. Alan Enton asks, what about the newer, to him, Psychology Today online room like Zoom? Are you familiar with that? I'm not familiar with the Psychology Today online room.
I'm not familiar with Psychology Today online Zoom. Practitioners use Zoom, and Zoom has, so you have to subscribe to what is called a HIPAA compliant Zoom platform. And usually it's a group of 10 practitioners, or it's a group practice that will subscribe to their services. So you can use, certainly a lot of practitioners use Zoom. I sometimes use Zoom as well, but I prefer Doxy.me. I'm not sure if I'm answering those questions, but Zoom is fine. You can certainly use Zoom if you have a HIPAA compliant subscription with Zoom, and you can also ask. It's the same way. You can do it a three-way video conference with the couples, or you can do. I usually ask them to be in the same room, so Zoom is fine. I don't know if there's any research showing that Zoom is more effective than any other platform, if that's a question.
So there's another question in the chat from Yelda Zemisar. She asks, as a clinician, can you tell us a little bit about your personal experience using video conferencing as a tool in your practice? For example, how difficult is it to read patients' body language or facial expressions? And how does this affect your experience as a therapist?
Yeah. So I will speak only from my experience. I have not found it to be difficult, although there's a part of me that thinks I might be missing a few cues, nonverbal behaviors that I may not be picking on. But I have been very surprised by my ability to perceive and also reflect what I sense, what's the couple experience or the individual experience. And when I intervene and reflect that to the patients, they seem to confirm that I get it, that I'm able to communicate empathy, that I'm able to empathize with their experience and understand them and reflect that to them. So in many ways, I have not been limited in my ability to communicate empathy and to understand their experience and perceive their emotions, which has been very surprising, which surprised me. So I did have expectations as well going into this, that I may be limited, but I have not been.
Corinne, I have a question for you, and that's about, and I haven't seen much written on this. all the literature that I've seen related to teletherapy online approaches tends to focus on cognitive behavioral therapy.
Yep.
As most of the measurement revolves around cognitive behavior therapy. But could you, and I'm not quite sure actually what your theoretical orientation is, although I've known you for a long time. Can you talk about your theoretical orientation a bit and how that may translate to teletherapy?
Yeah. So my orientation, I've written about it. So it's I'm a family systems therapist. I'm specifically grounded in the functional family therapy model. My approach is integrative. So I have used a functional family therapy model and integrated theories and concepts and interventions from other models to be able to deliver services to couples, and I've written about it. It is true that most of the work in telepsychology and the research is about CBT, and probably because it's a manualized treatment that makes it easier to transport and to maybe use online. Functional family therapy is also an evidence-based treatment in the field of couple and family psychology, and I think there is room for evidence-based treatments to be delivered online, and maybe the advantage there, especially manualized treatment, because they are manualized and there's a protocol. I think it's probably, I'm only sharing my opinion. It's probably easier also to deliver online in a more structured. So it's probably easier to deliver in a systematic way online and also to research as a result. I haven't seen a lot of research on other treatments.
Okay, so thank you. Ross Bonifacio has asked, expanding upon the last question, if you have audio only conferencing because someone may not have a webcam, etc., how do you deal with not seeing the patient visually at all?
I haven't dealt with this, so but that would be an issue. Although I do not, my preference, and that's a choice, it's to not do phone therapy, for example, and some patients may ask for it, but I strongly prefer having video, because without the video information, there's a lot that is missing in my assessment of what is happening with the patient. It limits your ability to assess, and that's so important.
Yeah. Robert Alexander is asking, can you speak a bit more about privacy concerns and what is different for you in privacy terms as a clinician? I imagine that some clients will have particular concerns that video and audio might be recorded or intercepted.
Right. So the technology we have right now, I can't guarantee this. This is this is not my area of expertise. But what I understand is the technology we have to deliver services is very secure. So it's the likelihood that it will be intercepted is slim. That's what I understand. And this is why we are authorized by our legislating body to use those very types of services, as long as they're HIPAA compliant. HIPAA is a law that we have to follow regarding privacy of information. Patients, it's from my experience, patients have never asked me if I was recording the session, although you could record the session on Zoom, right? But they've never asked about it. And I guess it's also an issue of trust between your patient and yourself. And some patients I have never met in person. I've only met them online. And so there is something to be said about the clinician and what they bring to the online room with the patient and their ability to build trust. We also have documents that we share with our patients where we explain all of this, all the limits to privacy and confidentiality. But to expand on the issue of privacy, while we may be able on our end to guarantee privacy or secure privacy, it's not always the same on the patient's end. So if you're working with adolescents, for example, and they're receiving services at home through using technology, you cannot manage whether you cannot stop a parent from entering the room. So I've heard also other stories, such as a parent has installed cameras in every room of the house, which makes it impossible to maintain confidentiality, because they can listen in or they can record what's happening in the adolescent's room. And they install cameras out of concerns, right? They're concerned about what the adolescent is doing. This is about inappropriate sexual behaviors, for example, and they want to be able to observe the adolescent at all times. At the same time, privacy we do not, the child or the adolescent does not have privacy. So these are some of the examples. With couples, you can have children walking into the room at any time, especially if they do not have, they don't have someone coming into the house to provide childcare. The children maybe are old enough to stay in the room for 50 minutes in a different room of the house, but there's no guarantee that the child is not going to knock at the door or enter at the moment when maybe the parents are arguing. So these are the type of issues that we run into.
I don't see any other questions. I have another question for you. This whole phenomena, especially if you're working in groups or couples therapy, right, where the couples are looking at each other on the screen as opposed to face in the room, and you talked about that, and you talked about asking the couples to face each other. Are you having to remind them oftentimes to do that, or what technique do you use to serve as a reminder?
Yeah, you do. You have to prompt them.
Mm-hmm.
You do have to prompt them, because people's first behavioral response when they're in front of the screen is to look at the screen. So they will look at you, they will look at the screen, and that takes away from their interaction with one another. So if I'm it's, in some ways I might say, maybe it's better if they are very negative with each other that they don't look at each other. Maybe that creates enough of a distance and they can look at me and it goes through me. But in some circumstances, when I want to get a sense of what happens between the two of them, then I have to prompt them. So you might say something, well, show me how it goes. Can you face each other? And show me how you talk about this. And they will, or I will prompt them to say, can you say this to your partner? Go ahead and turn towards your partner and say exactly what you said to me.
Are there any aspects of therapy that you feel that you absolutely cannot transcend through teletherapy at this point in time, simply because we don't have the technology, or that's not as accessible to you or the patients?
That's a good question. Can you tell me what you mean by transcend?
Well, you talked about, one example is you talked about the limited visual range, the delayed sound, the sense of connection, which is impeded. So I'm wondering ways in which you work through that, and or say, this is simply impossible to transcend.
Yeah. So it is, and so I now I understand. Yeah, it's very difficult to transcend the fact that I feel confined in a box, right? So even as a therapist, I also look at myself and am in a box on the screen. That's my presence, and this idea of telepresence is very important. Is how, and maybe technology will help us to get there, is how can I become more of a presence on the other end of the line, so I'm not in the box because I feel very confined. And so my ability to intervene and have more of a strong presence in the room with the patients, that I cannot transcend. It's very difficult, especially with the delayed sound. It limits my interventions, or maybe the power of my interventions on the other end. That's my impression. I have done well with it, but this is part of the experience that's limiting. And also the ability, the visual range, right? My field of vision is limited, so I'm not able to look around and see what's happening around them. And that is also something that, that I'm not able to transcend. And I haven't asked the couples I worked with, for example, to please hold the camera and show me around the room. That didn't seem like the appropriate thing to do. Or when they're talking and they're coming in and out of my field of vision, that has happened too. And that's not something that I can manage. So if there was a camera that was able to capture, if there was a camera in the computer that's able to capture the wider field of vision, and I don't know how that would work, that would give me more of a sense of what might be happening and capture more in their interactions.
That may be coming next. Right now it would be very expensive for patients and clients, but that may be coming next, right?
Yeah.
So we are out of time. Thank you, Dr. Datchi, for this extremely informative session. We all learned a lot. I'm getting some comments in the chat about that, and appreciate you taking the time to speak with us today.
Thank you.
You're welcome.
Thank you for having me.
You're welcome. And so everybody, the next seminar is on November 17th, also at 9 o'clock. We're going to have Dr. Brian Kuhn from UCLA, who's going to be talking about online racism as an emerging public health concern in the digital era. So that should also be informative and educational as well. So thank you, everybody, for joining us. And again, thanks, Dr. Datchi.
Thank you.